brown stain, if it gives purple and blue color, it is gram positive. If it gives a pink color, it is gram negative. But there are certain bacteria which do not stain with gram staining, and that is called gram staining limitation. Gram staining limitation. That means there is certain bacteria which do not stain with gram stain. And to remember the list of those bacteria, I like to share a sentence that I have a friend called Tammy, and when Tammy gets angry, she does not see left, right or center. So the list of the bacteria are: when Tammy gets angry, she does not see left, right or center. So what are these alphabets standing for? To remember, T stands for Treponema pallidum. M stands for Mycobacterium tuberculosis. M stands for Mycoplasma. L stands for Legionella. R stands for Rickettsia. And C stands for Chlamydia. Now, the Treponema pallidum is so thin that it cannot be stained, so we used fluorescent antibody technique to stain Treponema pallidum. Mycobacterium tuberculosis contains so much mycolic acid that it do not stains with gram staining, so we used carbon fuchsin staining or Ziehl-Neelsen staining. Mycoplasma has no cell wall, so it does not stain with gram staining. Legionella, Rickettsia and Chlamydia, all three of them are intracellular, so they do not stain with gram staining. Now, one thing you have to remember in Chlamydia is that Chlamydia lacks muramic acid. Muramic acid, which is responsible for forming the peptidoglycans, which forms the cell wall. So Chlamydia also lacks the muramic acid, which is required for making the peptidoglycans, and hence cell wall is not very well formed in Chlamydia. But the most important reason why it does not stain is it is intracellular. So we have to also see that there are certain bacteria which do not stain. So what do they stain with? So there has to be special staining techniques which can be used to stain the bacteria which do not stain with gram staining. So let's do the special staining techniques. What are the special staining techniques? To remember the special staining techniques, I would like to tell you that in India there is a legendary cricket player, and that legendary cricket player is Sunil Gavaskar. Now Mr. Sunil Gavaskar, he zips the ball to the boundaries, right? So how to remember it is, Mr. Sunil Gavaskar zips the ball to the boundary. Mr. Sunil Gavaskar zips the ball to the boundary. S stands for silver stain. G stands for Giemsa stain. Z stands for Ziehl-Neelsen stain. I stands for Indian ink stain, and P stands for periodic acid Schiff stain. So what are the bacteria which are stained with these techniques? To remember the list, the silver stain, FHL, like you have DHL, the very big logistic company. Similarly, the DHL, try and remember FHL. Giemsa staining, CBR, TP. Ziehl-Neelsen staining, MNC. Indian ink, this is one bacteria, Cryptococcus neoformans. And periodic acid Schiff, one bacteria, that is Proferima Whipple, which causes Whipple syndrome. So Indian ink is staining what? Cryptococcus neoformans. Periodic acid skiff is staining Proferima whipple. Now, what does FHL stands for? FHL stands for fungi, H. pylori and Legionella. And what does CBRTP stands for? CBRTP stands for Chlamydia, Borrelia, rickettsia. T and P. T is for trypanosomas. That is trypanosomas, and P stands for Chlamydia, Borrelia and rickettsia, trypanosomas and Plasmodium. P stands for Plasmodium. So these are the bacteria which are stained by Giemsa staining. Now Ziehl-Neelsen staining stains MNC, and MNC stands for Mycobacterium tuberculosis. N stands for Nocardia, and C stands for Cryptosporidium oocyst, CSO, that is Cryptosporidium oocyst. Cryptosporidium oocyst is responsible for diarrhea in immunocompromised patients such as people suffering from HIV. So these are the special staining techniques. So we have today covered the Giemsa staining limitation and special staining techniques.